Knee and joint pain is due in the predominant majority of cases to three rheumatic diseases: osteoarthritis, gout, and rheumatoid arthritis. In addition to pain, stiffness, and swelling in the affected joints, these conditions share other characteristics, namely, they are chronic disorders, they occur mainly in people over 40 years of age, and the discomfort varies in intensity and can even disappear in seasons. Rheumatoid arthritis is an immune disease in which a person's defenses mistakenly attack their own body's tissues. Approximately 1 in 200 people suffer from it, and it's more frequent in women than in men in a ratio of 7:1. Rheumatoid arthritis pain occurs symmetrically in several joints at the same time, for example, on both knees, on both arms, on the fingers of both hands, etc. This disease develops slowly over time, and in addition to the joints, in some people it also damages other organs such as the lungs, heart, intestines, eyes, etc. In severe cases, the disease can cause bone erosion and joint deformity. For its part, gout is a metabolic disease that occurs due to an increase in uric acid in the blood above normal levels, that is, beyond 7 milligrams over deciliter, because the kidneys do not effectively eliminate the uric acid, which then concentrates in the joints. In the countries of the Americas, gout occurs on average in 2% of the population, that is, 2 out of 100 people suffer from it, and it's 4 to 6 times more frequent in men than in women. In gout, pain and swelling occur suddenly in a single joint, for example, the big toe, knee, finger, or elbow. If not treated properly, over time tophi develop, which are masses of uric acid crystals that form painless subcutaneous nodules on the ears, the joints of the hands, or the backs of both elbows. Finally, osteoarthritis, also called osteoarthrosis or degenerative arthropathy, is a disease in which the protective cartilage that cushions the ends of the bones in the joints wears down over the years. Osteoarthritis affects only the joints and not other internal organs, as occurs, for example, in rheumatoid arthritis and gout. Considering that the diseases described above are of chronic evolution, their treatment is symptomatic and aims to relieve pain and inflammation, as well as prevent and slow down their development, for which there are magnificent natural remedies, among which rosemary, turmeric, and ginger stand out. These remedies have the property of acting in the same way as an analgesic and are excellent for reducing all types of joint pain. Rosemary tea. For its preparation is required 1 tablespoon of dried rosemary leaves, equivalent to 10 grams, or 3 tablespoons of fresh rosemary, a piece of cinnamon, and a cup of water of 250 milliliters. The water is heated, and when it reaches its boiling point, add the rosemary and cinnamon. Let the preparation boil for 2 minutes, then turn off the heat and let the formula rest. Strain, and that's it. Turmeric tea. To prepare this formula, you will need a tablespoon of grated turmeric, equivalent to 10 grams, 2 tablespoons of honey, and a cup of water. Heat the water, and when it starts to boil, add the turmeric. Let it continue to boil for 3 to 5 minutes. Then let it rest, strain it, and add the honey. And finally, ginger tea. The ingredients to prepare it are a tablespoon of grated fresh ginger, a stick of cinnamon, 2 tablespoons of honey, and a cup of water. After boiling the water, ginger and cinnamon are added, and the formula is left to boil for 3 to 5 minutes, then left to stand, strained, and sweetened with honey. Whichever remedy is chosen, it's recommended to drink 1 to 3 cups per day, maximum, for as long as necessary to eliminate pain. In addition to drinking any of the teas described above, for swollen feet, muscle pain, or joint discomfort, chamomile oil can be massaged on the affected areas for 10 to 15 minutes every 12 to 24 hours. The ingredients to prepare this oil are 100 grams of dried chamomile flowers and 500 milliliters of olive oil. The chamomile and the oil are macerated in a dark bottle with a stopper. The bottle should be shaken 5 times a day for 6 days. After the 6th day, the bottle is left untouched for 24 hours to separate the oil from the flowers. The resulting liquid is saved in the container, and that's it. Massages are not recommended in gout because in this disease, the pain in the affected joint is so intense that touch can't be tolerated. Chamomile oil can be indicated as a single treatment, but it can also be combined with the remedies described above and even can be applied simultaneously with taking allopathic medications. For those who prefer allopathic medicine, in osteoarthritis, non-steroidal anti-inflammatory drugs or NSAIDs are the drugs of choice. For example, meloxicam, ibuprofen, or diclofenac, administered orally, can be indicated. If the pain is very intense, acetaminophen can be added to the chosen anti-inflammatory. In patients from whom NSAIDs are contraindicated, oral tramadol may be prescribed alone or in combination with acetaminophen. Additionally, diclofenac gel can be massaged in the morning and at night for 5 to 10 minutes. If desired, instead of diclofenac massage can be performed with chamomile oil. Another method of treatment, only in the case of knee osteoarthritis with intense exacerbation of pain, consists of performing intra-articular infiltrations with glucocorticoids or hyaluronic acid at intervals greater than 3 months. Regarding surgery, the vast majority of patients with osteoarthritis will never need to undergo an operation for it. However, it may be helpful if there's extensive joint damage, persistent pain, and disability from limited joint movement. Both infiltrations and surgery must be performed where appropriate by specialist doctors. Regarding the treatment of acute gout attacks, the drugs used are the following: non-steroidal anti-inflammatory drugs, for example, ibuprofen, indomethacin, naproxen, or diclofenac. Colchicine, which due to the possibility of severe toxicity should be administered only when NSAID therapy is contraindicated or has failed, and glucocorticoids, for example, oral prednisone or intramuscular triamcinolone can be administered. In addition, it's recommended to elevate the extremity of the affected joint. Drink 2 to 3 liters of water daily and avoid foods rich in purines, such as red meat, organ meats, and alcoholic beverages. Proper treatment of gout allows people to lead normal lives. However, when there's inadequate control, complications such as severe degenerative arthritis, development of intra-articular tophi, and formation of kidney stones can occur. Let's see finally the allopathic treatment for rheumatoid arthritis. In this case, the drugs are very diverse, namely NSAIDs, which can relieve pain and reduce inflammation. Disease-modifying anti-rheumatic drugs, also called DMARDs, which can relieve pain and slow the progression of the disease. Some of these medications are methotrexate, leflunomide, hydrochloroquine, and sulfasalazine. Corticosteroids such as prednisone, which reduce inflammation and pain and slow joint damage, and biological response modifier agents, which include abatacept, adalimumab, anakinra, and etanercept, among others. These are drugs that act at the level of the immune system to limit the inflammatory process, which reduces the signs and symptoms and delays the progression of the disease. Both the type of allopathic drugs and the doses and duration of the treatment will be determined by the treating physician. Self-medication is not recommended. Finally, the treatment of rheumatic conditions includes physical activities that help reduce pain and stiffness, improve range of motion, strengthen muscles, and increase endurance. Therefore, it's advisable to perform low-impact aerobic exercises, such as walking, cycling, or exercising in the water. Instead, highly impact activities like jumping and running should be avoided. Well, that's all for now. See you in the next video.